Welcome, everybody. Thank you very much for joining us. This is the third in our series on long COVID. And this evening, we're delighted to have Dr. Sarah Myhill with us, who'll be speaking about therapies for long COVID. I'm sure you'll all know her. She's been with us many times. She's an honored member of our advisory panel as well. Dr. Sarah Myhill qualified in medicine with honors from the Middlesex Hospital Medical School in 1981, and has since focused tirelessly on identifying and treating the underlying causes of health problems, especially the diseases of civilization with which we're beset in the West. She's worked in the NHS and private practice, and for 17 years was the honorary secretary of the British Society for Ecological Medicine, which focuses on the causes of disease and treating through diet, vitamins and minerals, and avoiding toxic stress. I'll leave Sarah to introduce anything else she'd like to say about herself, please. As she gives a brief presentation before we go on to questions, could you put any questions you have into the chat box or also the Q&A, and we'll make sure we ask as many of them as we can. She'll be talking for 20-25 minutes, and then we'll go over to questions. So Sarah, thank you very much indeed.
Gillian, thank you for that very generous introduction. No, I don't want to say any more about myself. Let's leap to the theme of the meeting. And I'm going, as the IT numpty is going to try and screen share so that you can see what we're talking about. There we go. I hope that you can all see those slides and me yapping away on the side there. Okay, long COVID. How are we going to treat this? Long COVID is a post-viral syndrome, and post-viral syndromes are common. You know, there's a long history of post-viral syndromes like palindromic rheumatism, for example, and arthritis after viral infection. But they're going to become a lot more common. And recent studies suggest that after 12 weeks of acute COVID, about 10% of those who suffered will be experiencing the symptoms of long COVID. And the commonest symptoms include fatigue, foggy brain, shortness of breath. Now that's an interesting one, we'll come on to that, insomnia, temperature, cough, and so on. Clinically, long COVID looks exactly like ME, myalgic encephalitis, but the shortness of breath symptom seems to be one that's peculiar to COVID. Now, as for mentioned, they've been long recognized in the literature. And there are, I mean, the obvious one is the post-herpetic neuralgia that often follows shingles. If shingles isn't treated well and quickly and efficiently, you can end up with a persistent pain that runs on for a nasty pain for weeks, months, maybe years following. We all know of the chronic fatigue syndrome that follows glandular fever, which is Epstein-Barr virus. And in both these cases, you know, there's a very obvious direct viral driver. And we another important point about the post-herpetic neuralgia is that we know that if that is treated efficiently and quickly with antivirals, that greatly reduces the chance of post-herpetic neuralgia. That's really important. We also know, thanks to the work of Dr. Martin Lerner, that antivirals are often very effective in treating post-viral Epstein-Barr infection, ME. The problem is we don't have good antivirals for all viruses. So what we have to do is work out the mechanisms by which we're seeing problems and then work through them in a logical manner. So the first question I have to ask is, you know, what is long COVID? And the important thing to remember about long COVID is this is not a diagnosis, it's a clinical picture. And that is important from the point of view of treatment because the mechanisms are different. So in chronic fatigue syndrome, that is characterized by poor energy delivery mechanisms. So that person is pathologically fatigued. In ME, we have chronic fatigue syndrome plus inflammation. Okay, so we have to ask ourselves, so let's look at those symptoms and ask ourselves which symptom suggests which mechanism. So if the clinical picture of chronic fatigue syndrome is 3 groups of symptoms, which result from poor energy delivery mechanisms. So physical fatigue, and the characteristic of that is post-exertional malaise. If you overdo things one day, you pay for it the next. Then there's the mental fatigue, foggy brain, poor short-term memory, poor concentration, can't multitask. And then we have what I call energy conservation symptoms. Symptoms the brain gives you to stop you spending energy. Procrastination, depression, apathy. So it's not a cause of the illness, it's just to say the body being self-protective. And those symptoms we treat by addressing energy delivery mechanisms. And then we have symptoms of inflammation. And symptoms of, I mean, the pathological description of inflammation is pain, heat, redness, swelling, and loss of function. And inflammation is the great mimic. It can produce any symptom. One example of this is an excessive inflammation causes the cytokine storm, which kills people with COVID. And that's where there's a massive excess of inflammation. And of course, that's why vitamin D and vitamin C are so effective in treating acute COVID, because it damps down that serious inflammation. So the first thing we have to do in long COVID, because fatigue is a very common symptom and that is improve energy delivery mechanisms. Now, the analogy I like to use all the time is the car analogy, because guess what? I can get it and my patients can get it. And the body is a machine, a complicated one, albeit, but for your machine to work, for your car to function, you've got to have these 4 key players: the right fuel in the tank, and that's all about diet and gut function. You have to have a good engine that can take that fuel and burn it in the presence of oxygen to generate energy. And then you have to have the control mechanisms for that mitochondrial engine, which is a thyroid accelerator pedal and the adrenal gearbox. And they are the 4, say, big players. The starting point, and perhaps the most important, is the Paleo-Ketogenic Diet. And as I become old and perhaps more crotchety and perhaps more irritable, I'm toughen up on the diet. And my view is that this is non-negotiable. We know vegetarians and vegans, for example, are at greater risk of post-viral syndromes and fatigue syndromes. And I think it has much to do with diet. And the Paleo-Ketogenic diet is essentially paleo, because a very common cause of inflammation is allergy. And allergy to grains, gluten grains is very common. Allergy to dairy products is very common. So the paleo bit is no gluten grains, no dairy products. And then we have a ketogenic bit, which is carbohydrates. And carbohydrates, if you've got a gut that works perfectly and is great, functioning well, then we can deal with carbohydrates reasonably well. But the problem with modern diets is we overwhelm our ability to deal with those foods. And that tendency increases with age. And as a result, we end up with an upper fermenting gut. And this causes lots of problems in its own right. First of all, products of fermentation are toxic. This condition is also called the auto-brewery syndrome. And when you ferment carbohydrates in the upper gut, of course, the upper gut should be sterile. It should be a sterile gut for dealing with proteins and for fats. And the lower bowel, the colon, should be a fermenting gut to ferment fiber. What do we ferment that fiber into? Short-chain fatty acids, which are ketones, a very desirable fuel. So the upper gut, say, should be sterile. But if it ferments, all these toxins are produced: alcohol, D-lactate, hydrogen sulfide, aminoethyl compounds. They are all poisonous to the body. The liver has to detoxify all these ferments, and that consumes an enormous amount of energy and raw materials. In fact, I learned an astonishing statistic, which is at rest, the liver consumes more energy than the brain and the heart put together. It consumes 27% of all the energy generated in the body. So it's massively demanding of that. Another problem here is that it's not just alcohol, D-lactate, hydrogen sulfide. If you have a buildup of bacteria, fermenting bacteria and fermenting fungi in the upper gut, these will produce toxins: bacterial endotoxin, fungal mycotoxin, and these are toxic. That's why they're called toxins. And they too get into our gut, into the portal vein, to the liver, and maybe into the bloodstream, and they literally poison us. But then we have another problem here, because these microbes are as hungry as vitamins and minerals as we are. And if you have a gut, the upper gut, that's full of these fermenters, then when you take those expensive micronutrients, you're feeding them. they are getting the benefit from that lovely CoQ10, that magnesium, those B vitamins, instead of you are. And then on top of that, a fermenting gut is a leaky gut, hypochlorhydria results, which means you can't digest protein well, you don't empty the gut efficiently, you don't sterilize the gut well, and mineral absorption is impaired. One of my most hated drugs are the proton pump inhibitors, omeprazole, lansoprazole, and the likes, because they block acid production. And that is a major risk factor for cancers of the gut and also for osteoporosis, because you cannot absorb the minerals you need for your bone. And then there's another major driver of disease here, because I was taught at medical school that yes, the gut does have bacteria in it, but there they stay. And we now know that is not true. Those microbes do leak out into the bloodstream. It's called bacterial translocation. If you brush your teeth and you took a blood test 2 minutes later, you would find mouth bacteria floating around in the bloodstream. And if those unfriendly upper gut fermenters get into the bloodstream, wherever they get stuck, they will drive inflammation. So if they get stuck in joints, they will drive arthritis. In muscles, they'll drive fibromyalgia. In arteries, they'll drive arteritis. In skin, urticaria or eczema or maybe psoriasis, and in the airways, asthma. So, the upper fermenting gut is a major driver of pathology. And the starting point to treat it is a very simple approach. First of all, starve the little wretches out with Paleo-Ketogenic Diet, so don't feed them with those carbohydrates, and kill them with vitamin C to bowel tolerance. Vitamin C is one of my favorite multitasking tools. Not only does it help sort out the fermenting gut, it helps deal with pro-oxidant stress, it kills systemic infections. So again, if you have got virus in your body, the vitamin C will help to kill that systemic virus. So then once you've got the fuel in the tank right, we have to, as I call it, correct the engines, i.e. the mitochondria. Because if your engines are going slow, you're not going to be able to generate energy, and you're going to suffer all those symptoms of chronic fatigue syndrome, which is part of long COVID. And these are the common reasons why these engines may be going slow, because they have the wrong fuel in the tank. And we just talked about that. Mitochondria function best on ketones. One example of that is the keto adapted athletes. The middle distance and the long distance runners perform much better than those running on sugars and carbohydrates. They may be going slow because they lack the raw materials to function. I'll tell you exactly what those raw materials are in a moment. They may be blocked by something. And guess what? I've seen lots of farmers with organophosphate poisoning because organophosphates inhibit oxidative phosphorylation, which is the nasty chemical name which describes that energy generating process. The aerotoxic pilots, the Gall 4 veterans, the women with silicone implants, these all have mitochondrial lesions. Or, as aforementioned, the control mechanisms are wrong. You can have a perfect Formula 1 engine, but if the thyroid accelerator pedal doesn't go, you're going to be stuck on the starting line. So the raw materials we need for correcting our mitochondria are these. And in order of importance, we need magnesium. And again, using the car analogy, I think of magnesium as the spark plug. Well, I know engines don't have spark plugs anymore, but my old bangers, some of them do. So magnesium is essential, and vitamin D for its absorption. Again, back to good old vitamin D, another superb multitasking tool. At least 10,000 international units. And people think, oh, that's a big dose. It isn't. 10,000 international units is an hour of Mediterranean sunshine landing on the skin. And guess what? Primitive man was trotting around with 12 hours of full skin exposure sunshine. So vitamin D, that is not a big dose, that is essential. Many physicians, I know, including Damien Downing, would say more, at least maybe 20,000 IU. You can read, you don't need to read those out. D-ribose is very helpful as a rescue remedy. So if you really overdo things, and most people have got a pretty good idea of what they can manage without getting their delayed fatigue. If you really overdo things, it's a very useful rescue remedy. Take 5, maybe 15 grams at the end of the day, and that helps you to recover quicker. And then we have the control mechanisms, and the details of that are in that book. And I'm not going to go into that because I could talk all evening about that, and there are other things you want to do. But what it is important to do is to do things in the correct order. And so often I see people and they come to me and yeah, they're taking a great package of supplements and they're disciplined about their pacing, and maybe they've started to look at thyroid and adrenal issues, but they've not done the diet. And without the PK diet, you are going to malabsorb because it's very likely you will have a fermenting gut. So first of all, you do the PK diet and you make sure you're in ketosis, and a ketone breath meter is very helpful to ensure that. Make sure you're eating enough protein, enough calories, enough fiber. Then you take vitamin C to bowel tolerance, and that starts to give you a nice, tidy, clean upper gut. And then you'll start absorbing the supplements. Then you can start taking some mitochondrial supplements, some minerals, some B vitamins, and so on. So that is a rough run over energy delivery mechanisms. And then we have to look at the inflammatory component of long COVID, because there's no doubt these people have in it symptoms of inflammation. And we don't have a specific antiviral for long COVID yet. We have many things that are effective in the treatment of acute COVID, not just nutritional supplements, but now many drugs are coming to the fore that we know are effective. But we don't know if these are going to work for the treatment of long COVID. And the treatment of all these post-viral symptoms, starts with improving your immune defenses. It's up to the immune system to deal with these viruses. So let's give these immune systems the raw materials and the energy they need to function at their best. And then maybe there are other things we can do to help them. Okay, so the start of treatment of all fatigue syndromes, long COVID, ME begins with restoring natural immunity. And the principle I make here is that I've produced a book called The Infection Game, and when you write, it really makes you think about things. And I came to the view that life is an arms race. You and I are a free lunch for all these microbes that would love to make themselves at home in our very comfortable bodies, because if they can get inside us, they're lovely and warm, they're protected, they're in a nice moist environment, they're well fed, and they can have free sex and multiply themselves. So they steal our raw materials. And in response to that, we have evolved an incredible immune system that has to deal with that. And it's not just the immune system on its own. Our other immune defenses include having good quality skin, so infections can't get in through the skin, having an acid stomach, because 90% of infections come in through the mouth, and are either that or they're inhaled, stick on sticky mucus, cough up and swallowed. We need a nice acid stomach to kill those microbes as they get into our body. But if they should beat those immune defenses, then the immune system swings into action. And the first thing it does is it will give us symptoms like cough to expel the infection, like diarrhea to expel the infection, like vomiting to expel the infection, like fever, because these microbes hate heat. So the first principle of treatment is don't symptom suppress. Do not take a paracetamol to keep the fever down, or anti-cough medications to stop you coughing, or drugs to make you sleep, because not only do they suppress, they squash you, they also suppress the immune system. So allow the body to fight that infection as it does. And the reason why we feel ill when we get these infections is because it makes us go to bed, it makes us wrap up nice and warm, and it helps us to run a fever. Fever is a very good thing to do. The next thing we do is cut out the sugars and carbohydrates. All infections love sugars and carbohydrates. And that's why the overweight and the diabetics have such a high mortality from COVID-19. And as I say, you can read the statistics there. Those people who are overweight were much more likely to end up in ITU. And of the 38 patients that did, I say they all had a BMI above 30, 8 of them died, and they all had a BMI above 34. So the starting point to prevent acute COVID and to treat long COVID is a low carbohydrate paleo-ketogenic diet. And again, we know from the figures that vitamin D is highly protective. And we know in long COVID there is an inflammatory component. Vitamin D is the most important anti-inflammatory in the body. So vitamin D is going to be an important part of treating long COVID. Again, we know from acute COVID that vitamin C is highly protective, and we should all be taking vitamin C to prevent acute COVID, and in particular to treat long COVID. It's all the same. We have to, the immune system is enormously demanding of vitamin C, and when it is busy and active, our requirements for vitamin C increase enormously. And wonderful studies done by Fred Klenner, by Robert Cathcart, who treat a whole range of viral diseases from pneumonia to septicemia to polio, big dose of vitamin C with remarkable results. Another very useful treatment for acute COVID, and maybe for long COVID as well, because we're trying to reduce viral load, is vitamin C. A big one is iodine. Iodine contact kills everything. And there's some excellent papers showing how gargling with iodine will get rid of virus, within a few seconds. Sniffing or inhaling it is also a very good way of getting rid of virus. So those are sort of standard interventions that you would put in place for almost any infection. It doesn't matter what it is, before the diagnosis has been made. In fact, one of my favorite quotes is Frederick Klenner, who says, in the event of any acute disease, the patient should take large doses of vitamin C whilst the physician ponders the diagnosis. So don't wait to be told it could be this, it could be that. Just dive in there with big dose of vitamin C, vitamin D and iodine, and give your immune system the best sort of chance. But then we end up with the problem of the chronic inflammation. And there is no doubt with long COVID, there is a chronic inflammatory reaction, which is almost certainly driven by persistent viral presence, which may be there switching on allergy, it may be there switching on autoimmunity. But inflammation is I think of it as like a fire. Once lit, it almost has, a momentum of its own. And there are lots of general interventions that we can do just to damp down inflammation, regardless of the cause, whether it's the diet, the supplements, detoxification regimes, or whatever. And many more details are in those books. So, and those general interventions, I call groundhog chronic. I call these interventions groundhog regimes because, like the film Groundhog Day, where our hero comes back and relives the day and goes over to try and get another outcome, I call these groundhog interventions because I talk about them over and over and over again. This is the absolute starting point to treat any chronic infections, and those are detailed in the book The Infection Game. Okay, those are, so I've just run through some of the treatments that we can use for specific infections. We've talked about a little bit. Remedies for acute COVID are there, but we have yet to find out what's going to work well for long COVID. But a very useful starting point is a technique called microimmunotherapy. And I think of microimmunotherapy as, if you think of it's treating the immune system, and it is to, we have conventional treatments for the immune system, which usually are heavy duty, treatments like chemotherapy drugs, steroid drugs, which, are a hammer to crack a nut. There are major immune suppressing treatments that we really don't want. And I always think of microimmunotherapy is to the immune system what psychotherapy is to the brain. It's a very subtle treatment. It's a way of re-educating the immune system. And it is of proven importance, for example, proven effectiveness in herpes infections, for example. And remedies that can be used to reduce the infectious load, well, there's a remedy called EID, which would be very helpful. The other point here is that we know that COVID-19 will unmask underlying infections, and the best document of these is Epstein-Barr virus. And this is where it can be very helpful to get tests done, maybe at army laboratories, to see if these underlying infections have also been flared up, because some of them may well be responsive to specific antimicrobials. As I say, it really is a case of watch this space, because these treatments are evolving, but they do seem to be effective. The symptom that seems to be peculiar to long COVID and different to ME is this symptom of shortness of breath. Now, Again, nobody is quite sure, what it is that's going on here, but we have got a few clues. For example, with acute COVID, we know that hypoxia is very common. Patients present with, they're obviously not well, they've got some respiratory symptoms, but when you look at their oxygen saturations, they're in respiratory, they look as if they're in respiratory failure. They've got oxygen saturations of 90%, 80%, or even less. And what we now know in acute COVID is the mechanism of that is the virus strips iron off hemoglobin. And what that means is that hemoglobin cannot carry oxygen. So the oxygen carrying capacity of the blood is massively reduced. If you just did a blood test, you'd say, well, they're not anemic, but if there's no iron in the hemoglobin, it can't carry oxygen. And that causes a very severe shortness of breath. And that may turn out to be part of the mechanism for long COVID. But this is some evidence that's developed that the COVID patients were breathing incorrectly, shallowly through the mouth and into the upper chest. And this caused an autonomic disturbance. And clinically, it looks like hyperventilation. And hyperventilation means that when you overbreathe, you wash out carbon dioxide from the bloodstream, and that has the effect of oxygen doesn't stick as avidly to hemoglobin as it should. And again, this impacts on oxygen delivery to the tissues. On my website, there's a lot more description about hyperventilation and how it manifests. But the point is, there has been some success treating patients with long COVID who have this shortness of breath symptom with hyperventilation techniques. And you may or may not be aware of the Buteyko technique. I don't think I've written it there, but it's Buyteko, which is a very well recognized treatment for hyperventilation. I haven't got a patient that I've tried that on because this is something I've learned in the last week. The shortness of breath is a symptom I've been pondering about for some time, and this is one possible explanation. What I do know about hyperventilation is it's often adrenaline driven, and the starting point to reduce adrenaline levels is again a paleo-ketogenic diet. If anybody wants more information, then I regularly run workshops that you can join where you get me talking all day about any subject that you fancy, but it tends to be chronic fatigue syndrome and ME. So I promised Gillian I wouldn't talk for too long. I hope I've stuck to my 20 minutes because it's much more interesting when the questions come through. So if anybody's got any questions, I hope you've been pouring them to Gillian. She will pour them out, let me know, and I will do my best.
Thank you so much, Sarah. That was full of tremendous information, and we will have the recording up on the website within about 3 days. And may we have your charts as well, Sarah?
I beg your pardon?
May we have your slides as well?
Yes, of course,
yes,
of course.
So we'll have those as well to study in a bit more detail. So a few of the questions that have coming in, for example, how would you treat histamine intolerance? Do you see that as a sort of separate entity within this whole phenomenon?
Histamine intolerance is part of mast cell activation syndrome, and we have to ask the question, what is activating mast cells? So again, it's an indication that person is in a pro-inflammatory tendency. Now, if you go onto my website, there's a whole page about mast cell activation syndrome, so anybody can help themselves with that. But again, it's going to be driven by allergy. I think it's very likely it's driven by the fermenting gut. So again, the starting point, paleo-ketogenic diet, vitamin C to bowel tolerance, and all the interventions to damp down inflammation, which might be antihistamines. In fact, they are pretty benign drugs, and very helpful to take those, because as I call it, we've got an inflammatory fire there. We have to put the immune system in a straitjacket and stop it reacting. And again, there's a microimmunotherapy remedy called allergy, which tends to switch the immune system from a Th1 to a Th2 state, i.e. an anti-inflammatory system. So we're trying to say, put out the inflammatory fire. And magnesium again, stabilizes cells and damps down inflammation. So there's people have been gulled into a sense of security by doctors thinking of one symptom, one drug, and that's the answer. And it's not like that. A mast cell activation syndrome is one of those conditions where there is no single intervention that does it. It's a whole package of treatment. As I say to my patients, this is not a battle, this is a war. You started with a paleo-ketogenic diet, and vitamin C to bowel tolerance, and then high dose vitamin D and omega oils and magnesium, in order to start to tamp down the inflammation generally. Low dose naltrexone for some patients is very helpful. Some patients find CBD, which is CBD oil, which is anti-inflammatory, that is helpful. And getting people well, it's like playing cricket. I can give you, the rules of the game and the tools of trade, and point you in the right direction, but everybody finds out their own path. Everybody works out what does it for them. And if you learn nothing else from this wretched illness, it's that you have to become your own physician. Because you are, guess what, you're the best motivated to sort it out. You're in tune with your symptoms from day to day, and you work it out. You work out cause and effect. And so often, by putting these groundhog regimes in place, as I call it, you clear those muddy clinical waters. Because people come to you when they're sick and they've got shopping lists of symptoms, and one symptom could mean 3 or 4 different mechanisms. But as soon as you start to get these regimes in place, it becomes cause and effect becomes much more straightforward to discern. So, you just, even if you're not quite sure what's going on, go through the groundhog regimes, and very often things, become more clear.
Thank you. One question here is, if a patient is, or therapist even, is sensitive to ascorbic acid and finds it irritates her bladder, how can you take vitamin C to bowel tolerance?
Okay, well, vitamin C, the cheapest and the best is ascorbic acid. But as you rightly point out, some people don't tolerate the acidity. And what I suggest they do, and the cheapest way to do this, is to mix this with a bicarbonate. Magnesium carbonate I like to use, because if you mix it with magnesium carbonate, it also gives you a nice dose of magnesium. So they combine, so you end up with magnesium ascorbate and magnesium bicarbonate. And the recipe is by weight, 2 parts of ascorbic acid to 1 part of magnesium carbonate, and that gives you a neutral solution. You can do the same with sodium bicarbonate if you prefer that. And again, as it so happens, the recipe is the same. 2 parts by weight of ascorbic acid, 1 part by weight of sodium bicarbonate. But you might end up overdosing with sodium if you do that, and sodium is a less desirable mineral than magnesium. So these days, I prefer magnesium. You can, of course, buy magnesium ascorbate, but it's just much more expensive.
Okay, thank you. Can one do the PK diet with hypothyroidism?
Oh, gosh, yes. And it's totally desirable. In fact, there's a very, very interesting relationship between the PK diet and hypothyroidism. Because when you do the PK diet, you cut out the carbohydrates, there's always a tricky time that people call it keto flu or the metabolic hinterland, whilst the body learns to get into fat burning mode. It learns to get into ketosis, and it takes at least a week and sometimes 2 weeks. And people can feel quite awful during that time. So you absolutely have to stick with it. But if that awfulness persists, if that awfulness really doesn't improve after a couple of weeks, then people sometimes feel that they've got low blood sugar, although they haven't. They're running on ketones fine. And that clinical picture is called ketogenic hypoglycemia. And I think that is typical of hypothyroidism. The point here being that to be able to fat burn, you need thyroid hormones. If you haven't got the thyroid hormones for fat burn, the body will use adrenaline instead. And of course, when you get hypoglycemia, you're not getting symptoms of low blood sugar, you're getting adrenaline symptoms. All the low blood sugar symptoms are adrenaline symptoms. And just to illustrate that point, if I'm here in my clinic, of course, all my patients have to be in ketosis. If I do bloods for, another reason, sometimes, the lab will get back to me as a matter of urgency. Oh, your patient's only got a blood sugar of 1.5. Oh, they've only got a blood sugar of 2. You better tell them to go and have some sugar. Do those patients have any symptoms? No, they have no symptoms at all. And the reason is they're they're fueling their body with ketones. They don't need to use that sugar as a fuel. They're burning quite happily with thyroid hormones, so they're not spiking adrenaline, and they feel as right as rain. So ketogenic hypoglycemia is often a symptom of hypothyroidism, but if you're hypothyroid, then gosh, yes, absolutely, you still need to do a PK diet.
Thank you. Some of this overlaps with what you've just said, but I'll read the question as is. Please could you elaborate on the safety of using iodine and ketogenic diets in those with thyroid, autoimmune thyroid conditions?
I think that the potential of iodine to generate autoimmunity has been massively over-egged. The allergic reactions to iodine almost always are triggered by or occur when iodine is used intravenously as part of procedures to look at the brain using radioactive, iodine dyes or whatever. So iodine allergy in practice is very uncommon. When Lugol's iodine was developed 200 years ago by Lugol, they were using massive doses of iodine to treat a whole range of thyroid conditions, from underactive to overactive. So, I really do think the problems of iodine have been massively over-egged. And I like to use iodine. Well, I like to use iodine. It's the perfect sterilizing agent to be used from the outside in, as I call it. So for any skin lesion, any infected lesion, infected toenails, dandruff, infected skin, I make up iodine oil, which is very cheap. Anybody can do this. You get a pot of coconut oil, and you use 10 parts of coconut oil for 1 part of Lugol's iodine, and it gives you a sort of orangey gloop like that. And that, if you're worried about getting a COVID contact, take a small amount onto your fingers like that, rub it onto your hands, rub it onto your face. That will contact kill all virus, in seconds. So it's the perfect antiseptic to use if you're going out. We now know that gargling with iodine, and there are good papers showing that kills COVID in the air, in the mouth and the throat, or sniffing iodine, and I use just a salt pipe, which is just a plastic tube into which you can put just a plastic tube like that, into which you put a couple of drops of Lugol's iodine and then sniff it. And if you can smell the iodine, you have a therapeutic dose. And again, that contact kills, all virus in the airways and in the lungs. And to illustrate that point, I now have 5 patients who have bronchiectasis. Now, bronchiectasis is chronic lung infection, and they spend their lives normally going from one infection, antibiotics, okay for a bit, another infection, more antibiotics, until they end up with a multi-resistant staphylococcal aureus, and then they're in deep trouble. Since doing these regimes, the groundhog chronic, vitamin C, Paleo-Ketogenic Diet, all things that we've discussed, and sniffing the iodine, their need for antibiotics has reduced to 0. 1 or 2, if they've reneged on the diet and done things wrong, then okay, they've had a bit of a flare of their chest and they've needed antibiotics again, but it's been a wake-up call to them. And they now know they can control their bronchiectasis perfectly with these simple nutritional interventions.
Thank you. Someone who has oxalate sensitivity, would you still make the same recommendations regarding vitamin C to bowel tolerance?
Absolutely. In fact, there's good evidence that oxalates are a mycotoxin. And I suspect, oxalates may, yes, we know they're present in some foods. Rhubarb is an obvious example. But my guess is that they are, well, we know that they're a mycotoxin. And again, that points to upper fermenting gut by fungi. Oxalates have the potential to precipitate out, but vitamin C dissolves all renal stones. Again, when I was writing my book, Ecological Medicine, I researched that in great depth, and I couldn't find a contraindication for using vitamin C in any form of renal disease. In fact, Paul Marrick, who is a physician, he's a specialized in infectious diseases in Canada, he uses intravenous vitamin C in very high doses to treat his patients with acute infections, whether from septicemia to acute COVID. And he says in all cases, the renal function has improved. There have been no renal side effects from vitamin C. As I say, it's a fabulously safe intervention and widely used, and rightly so.
Thank you. 2 further questions about the PK diet. Is it safe to do it with no gallbladder? And is it safe for someone who suffers from hypoglycemia due to gastric band surgery?
It's totally desirable in both. Gallbladder disease is part of metabolic syndrome. Gallbladder disease results from people eating high carbohydrate diets and having fermenting guts. we evolved to have diets which are high in fat and fiber. And if you have a high fat diet, you improve the flow of bile salts, bile from the liver, and you dissolve those bile stones. So absolutely, totally desirable. And again, for hypoglycemia, the point is, if you are fueling your body with ketones, you will never get hypoglycemic again. I mean, just one example of this, there's a GP down in the south called Dr. Ian Fruit, and he is a type 1 diabetic. He controls his diabetes entirely on a ketogenic diet. He has to have a little bit of insulin because all type 1s have to have a little bit, but if your carbohydrate load is so low, then it remains at a little bit, no insulin resistant results. He decided to do a 5-day fast together with 4 of his friends, some of whom were diabetic. One was Olympic athlete, Matthew Pinchon. And during that time, they ran 20 miles every day. Wow. And they fasted. And none of them suffered from hypoglycemia. Yes, of course, had to drink water and electrolytes. His insulin requirements was exactly the same. His blood sugar levels were absolutely level. It's the point here, as soon as you get off the carbohydrates, as soon as you're not fueling yourself with carbohydrates, the sugar problem goes away. It's just the starting point to treat all forms of diabetes, type 1 diabetes, type 2 diabetes, and of course, Alzheimer's disease is now being called type 3 diabetes. It's a sugar problem in the brain. And we know Dale Bredesen, California, reverses type 3 Alzheimer's disease with a ketogenic diet and all the other stuff we talked about, the mitochondrial stuff, the thyroid stuff, and so on. So yes, really and truly, the paleo-ketogenic diet is the starting point to treat all Western diseases and possibly even all diseases.
Mm-hmm. Thank you. What about anosmia? This is a therapist whose patient has been suffering from loss of smell for more than a year after having COVID. Have you got any thoughts on that?
Well, that just illustrates perfectly how this virus is neurotoxic. The olfactory nerve, which is responsible for smell, is an extension of the brain. And what anosmia is that's the virus getting into the brain and damaging nervous tissue directly. So, the treatment of that is going to be, groundhog chronic is going to be the starting point. It may well be that sniffing iodine, if there is a viral load in the brain, may be very helpful. I'm a great fan of vitamin B12 injections, and anybody with any neurological disorder is often very much helped by that. They're very easy to do. It's easy to get vitamin B12 online. You can self-inject, and many of my patients, absolutely love that as a treatment. But I haven't seen enough patients with. In fact, I don't think I've seen any of my long COVID's got anosmia. It seems to be something that they got with their acute COVID and then seemed to improve.
Loss of taste. You can often improve that with zinc, can't you?
Well, taste and smell are two different things, and people confuse them. I mean, taste is what goes on in the mouth, and what we sample on our tongue. That's the salt, the sweet, the bitter, and something else. But most of taste is actually smell. It's what we detect as those molecules, evaporate up the back of our throat and come into our noses, and we sense them there. But yes, you're absolutely right. You can improve zinc deficiency is a common cause of loss of taste.
Thank you. What about clients who need to be on a PPI to protect their stomach from other drugs that they have to take for other chronic conditions?
Well, my view is if you do the paleo-ketogenic diet, then you absolutely don't need them. And you also have to ask the question, well, the way you would start with those people is say, well, what other chronic conditions do they have and why are they on those drugs? Now, the obvious thing is they're probably on non-steroidal anti-inflammatories for their arthritis. But that is very bad news for arthritis because inflammation is part of healing and repair. And what we do know is that people who have arthritis, who take the non-steroidal anti-inflammatories, they get to their need for joint replacement surgery much more quickly than those that don't take those drugs. So that's one possibility. Again, many people will take aspirin-like drugs or clopidogrel-like drugs to thin the blood because they're at risk of vascular events. But what makes for sticky blood? Sugars and carbohydrates. As soon as you go on a paleo-ketogenic diet, you stop that pro-thrombotic tendency, that clotting tendency, and the need for those drugs just melts away. So that's what I would say to those people. First of all, ask why you're on those chronic drugs. Let's be looking at the underlying causes of that. In fact, in the Bible that Craig and I finished fairly recently, it's called Ecological Medicine, and that goes through, all, not that I'm trying to push my books, but that goes through, all the chronic pathologies from cardiology, neurology, nephrology, gynecology, obstetrics, pediatrics, the common pathologies there, and why and how these tools apply. And when you start to peel off those onion layers of complication and get rid of the statins and get rid of the blood thinners and get rid of the non-steroidals and the steroids, then you don't need the other drugs. And I think this illustrates the point beautifully, how thinking for doctors has become so planar, so linear. It's symptom, drug, symptom relief, but then drug side effect, complication, another symptom, another drug, and so it builds up. And people come to me on cocktails of drugs, and there's some lovely case histories in there. People with heart failure, heart disease, cancer, on loads of drugs, and we get the regimes in place, tail the drugs off, and they feel much better just for that, because all those prescription medications are a toxic load. So please, you guys, don't suddenly just say, well, I'm going to stop those drugs. Ask the question, why? Why am I taking them? What are the mechanisms that these drugs are? By which mechanism are these drugs addressing my disease process, and work through things logically. As Linus Pauling said, follow the science, follow the logic.
And does the recommendation for the PK diet also apply to patients with the ApoE4 SNP? That's a polymorphism.
I have to say, I don't place too much store by those genetic tests, because they don't give us absolutes, they give us tendencies. And so the thing is, I don't know the answer to that question. But when people say to me, where's the evidence for the Paleo-Ketogenic diet? I say about 2.5 million years of evolution. That's what primitive man consumed. They then turn around and say, oh yeah, but when they dug out Bogman, they found some seeds and some pulses in his gut. Yes, but only in the autumn. In the autumn, where there's a free windfall, where there's a free harvest of all these high carbohydrate fruits and nuts and root vegetables and pulses and grains, when there's a free windfall, yes, we eat those, and we eat them in an addictive way, and we get fat. Fat is survival value for the winter. Primitive man stopped eating those foods because he had no choice. He just ran out. But now with our modern agricultural systems and food delivery systems, we can eat those foods all year round. And we do because we can. We get addicted to them, and we never switch that addiction gene off. So, the Paleo-Ketogenic, am I in ketosis 24/7? No, I'm not. At the weekend, I have a jolly with my friends and I'll have a glass of wine and I'll slip out of ketosis, but it doesn't matter. You do that occasionally, that's absolutely fine. But when you're in permanent autumn mode, metabolic syndrome, high sugars, high carbohydrates, that is what's driving Western pathology, including poor immunity. And that is why those people are susceptible to acute COVID and die from it, and are going to be more susceptible to long COVID. And therefore, that is the starting point to treat and prevent.
Okay, thank you. Should vitamin D dose be titrated against blood levels, or would you just suggest giving 10,000 IUs constantly without doing measurements?
Correct. It's not necessary. I mean, the gap between the therapeutic dose and a toxic dose of vitamin D is huge. And guess what? Blood tests are expensive and time consuming, and many people, they're just not accessible to many people. So no, I wouldn't bother with the blood test. I know what the result's going to be. I know that if somebody is taking 10,000 IU vitamin D daily, they can have blood levels of over 100 nanograms per mil. And at that level, their risk of dying from COVID is 0.
And we are talking about long COVID at the moment, I understand.
Well, but the point is that what we know about acute COVID also applies to long COVID. We're just talking about the same condition, but in a long form, if you like, rather than the brief form. And what helps acute COVID is going to help long COVID as well.
I've heard that shortness of breath can be due to mycoplasma reinfection. Have you seen this?
Well, I haven't seen that, I have to say, but we do know that COVID-19 will unmask an underlying infection. As I say, life is an arms race. We are all carrying microbes all the time. I mean, 90% of us have got the Epstein-Barr virus, in our bodies. Many people are carrying herpes, gentle herpes, shingles, cold sore herpes. We know these nasty viruses drive nasty diseases like dementia and cancer. But if the immune system is tip-top shape, it keeps the little wretches at bay. I say life is an arms race. But if you get an overwhelming infection with something else, and the immune system's attention is suddenly directed at those other things, maybe it hasn't got the energy and the raw materials or the attention to keep those little nasties at bay. And they perceive this, the wonderful opportunity to flare up and reproduce and pass themselves on to somebody else. So yes, it's entirely biologically plausible that that should be the case. And we often see that. I mean, the obvious case is HIV infection. When you get to full-blown AIDS, you get an immune suppression with that, and lots of other nasty conditions rise up in consequence. So yes, there is an immune suppression simply because the immune system is busy fighting one thing and hasn't got the time to look after the others.
That makes sense. This is a patient who's been 14 months into long COVID, but has persistent joint issues, has had a serious, I presume anyway, lung flare, steady progress, but is wondering, he finds he gets hugely better in the sun and near the sea. Wondering whether you have a few additional tips.
Okay, well, one of the most difficult group of conditions to treat are mold conditions. And the best test and the cheapest test is to send people on a holiday to a hot, dry climate, because there the mold numbers are very low, and that gets around the problems of numbers of and allergy too. And okay, it's difficult to get away to a hot, dry climate in this country at the moment, but what you can do is get down onto the coast, because molds cannot live on salty water, and at the coast the prevailing winds are onshore. And if people say to me, I feel much better when I'm down on the coast with that fresh sea air blowing on, I immediately think a mold issue. And where do molds hang out? They hang out in the sinuses, and some people don't have any symptoms of sinusitis or postnasal drip or runny nose, but the molds can be there. And the best way to deal with that is, salt pipe with iodine. They hang out in the gut, and you have upper fermenting gut, and the treatment for that is starve little wretches out with the ketogenic diet, kill with vitamin C to bowel tolerance. And then some people have eczema of the ears, external ear around the ear, that can be fungal. They may have fungal nails, they may have chronic vaginal candidiasis, and all those conditions are amenable to iodine. If you don't want to make up your own, you can buy betadine, which is the pharmaceutical version of iodine. Again, works very well. But the key is keep using it. The area of skin or whatever has got to be stained slightly yellow, so the iodine is there. Iodine is very volatile. If you put it on your skin, it'll stay there for a few hours and then it just disappears. Some of it will be absorbed, obviously, but you've got to keep applying it. Don't just think, once a week will do. It won't. Keep lapsing it on.
Thank you. This is a patient who finds that his recovery is always knocked back hugely for weeks if he has any wine. He actually seemed to develop his long COVID, coincidentally, perhaps on the same night he'd been drinking a year ago. And he's wondering, he can take tinctures which contain ethanol. So he's wondering if there might be a reason for why wine rather than ethanol.
Well, the dose of ethanol in wine is much higher than that in the tincture. And I think that alcohol intolerance is a feature of fermenting guts. In fact, when I started getting interested in patients with fatigue syndrome in the early 1980s, I worked a little bit with a guy called Professor Fields, who was at Warwick. And he was one of the very few clinicians who accepted the existence of ME and chronic fatigue syndrome. And he used to say, if they don't have alcohol intolerance, they haven't got chronic fatigue syndrome and ME. He reckoned it was universal. I'm not sure of that, but it is very common. But I think alcohol intolerance is part of the upper fermenting gut. Because if you are fermenting, you're producing alcohol all the time, and you're overwhelming the ability of your liver to deal with that alcohol, which means when you drink, it goes straight to the head and you get very heady and a glass of wine and you're absolutely happy. So that's one possible mechanism. But alcohol is also a solvent, and all wines will have yeast in them. And my guess is when you have the yeast dissolved in alcohol, you suddenly get a big antigen load of yeast that hits you. And my guess is we're talking about yeast allergy in this person's case. Those people who do enjoy and can tolerate a bit of alcohol but are yeast allergic, they're better off with spirits because spirits have been distilled and the yeast burden is less. So again, not every night, obviously, but for the occasional treat, you'd be better off with a vodka with some fizzy water and some lemon juice or something squeezed into.
Oh, okay. That's interesting. Thank you. What advice would you give someone with active chronic Lyme and now over 1 year of long COVID?
Well, Lyme disease is another chronic infection. And it has to be treated in the same way as any chronic infection. So the starting point to treat Lyme disease is, dare I say it, groundhog chronic, improve the immune defenses. And that done well, some people will recover. But Lyme is always going to be difficult. And so the starting point is the groundhog regimes. Then you might tackle in some of the herbal regimes, and there are many herbal combinations that are effective for Lyme. And some people just have the drugs because Lyme is a nasty, tough little spirochete that's difficult to get rid of. And it's a little bit like treating patients with tuberculosis. The tubercle bacillus is a nasty, tough little microbe, and you need combinations of antibiotics for months to get rid of it. So it is the same with Lyme. And for that, you can have a consultant who understands Lyme and will prescribe those things. But don't leave it to the antibiotics alone. So often I have people who come and see me, they've been correctly diagnosed with Lyme, they've been to Armin, they've got a high ELIS swab test, we know they've got it, and they have the antibiotics and they are no better. And the reason they are no better is because antibiotics will give you a percentage kill and it's up to the immune system to do the rest. And if your immune system is in rotten shape because you're eating the wrong foods and you've got a fermenting gut and you're not taking decent amounts of supplements, the immune system can't nip those last little bugs in the bud. And when you stop the antibiotics, they just come straight back again. So, I know I'm very boring when I say this, and my daughters tell me I'm very boring sometimes, but you've got to start off with the basics. You've got to get the immune system in tip-top shape. And then you have a much better chance of the antimicrobials, whatever they may, whether it's microimmunotherapy, whether it's whether it's herbals, from drugs, it doesn't matter, much better chance of those being effective.
Yeah, no, it's wonderful because this is all within our own power to do. Another patient who's got long COVID says that her body seems to be becoming increasingly nocturnal with sleeplessness. Could this be a sign of brain inflammation?
Well, absolutely. There are many possible reasons for poor quality sleep. And again, I spend a lot of time talking about sleep with my patients. The commonest cause of disturbed sleep is nocturnal hypoglycemia because you spike adrenaline and that wakes you up. So guess what the starting point to treat sleep is? The ketogenic diet. Secondly, we need hormones in the right order for the best quality sleep. And that all starts with light. So we need to get as much full spectrum light, sunshine on our skin as we possibly can during the day. And then as that light diminishes, we start to use melatonin. Of course, melatonin is the sleep hormone that's produced by the pineal gland. As melatonin levels rise, that kicks the pituitary into life, and the anterior pituitary produces thyroid stimulating hormone. And thyroid stimulating hormone then spikes at midnight, and TSH then kicks the thyroid gland into life. So that T4 spikes at about 4 o'clock in the morning. That is then slowly converted into T3, which is the active hormone. T3 spikes about 5 o'clock in the morning. That then kicks the adrenals into life, and the adrenal glands produce cortisol and adrenaline, and that wakes up at about 6 or 7 o'clock in the morning. So there's a whole hormonal cascade there that ensures we get good quality sleep and at the right time of day. So that's the next thing you have to do. Look at the thyroid, look at the adrenals, think melatonin. But yes, we all know. What I also know is the toxic brain doesn't sleep and the inflamed brain doesn't sleep. So, sleep can be very difficult. I'm not a fan of hypnotics for sleep because they're just knocking you out cold and that knocks everything out. But, sometimes in the short term, they are useful to restore a pattern. But sleep is difficult.
When you say Do you mean there specifically?
Well, antihistamines, the sedating antihistamines can be helpful. Valerian can be helpful. I mean, prescription drugs, sometimes can be helpful. In fact, I remember I had one guy who came to see me some years ago whose chronic fatigue dated from being mugged out in the Far East. Remember, it was one of the countries. He was hit on the head with a lump of lead piping or something, and he was knocked unconscious. He was 3 days unconscious, and then when he came around, and he had a chronic fatigue syndrome. And what was central to him is he could not sleep. And we tried the usual things, and and eventually I said, you must try sleeping medication. No. He said, I'm not going to do that. I'm not going to do that. I'm not going to do that. And eventually, after about 2 years, he relented and started taking Zopiclone at night. And that's a cure for him almost, because suddenly he could sleep. And of course, when you sleep, you can heal and repair, and then you can have a decent day. So my guess is that smack on the head, disrupts his sleep center so badly that he was unable to sleep, at all. Now that is very unusual, I have to say. That's not a common case, but it illustrates the point that sometimes these prescription drugs can be useful.
Yeah. Just one or two more. I know we've already got to 8 o'clock, but there are so many questions here. What are your thoughts on inhaling glutathione through a nebulizer to try and oust the remaining COVID-19?
Well, glutathione isn't an antimicrobial. So I'm not quite sure how that would work. I mean, you can't do any harm with that, so I can't see any objection to that. But glutathione is part of glutathione peroxidase, which is an important antioxidant, and it's essential for detoxing. But I doubt it has antimicrobial properties. If it does, then you've taught me something tonight, so thank you for that.
Okay. And is it okay to use iodine even if you have Graves' disease?
I can't see why not. But Graves' disease is usually pretty short-lived, and it's usually controlled by either carbimazole is the usual one, and then it settles down. But again, in the 200 years ago, iodine in big doses was the treatment for Graves' disease. Now, I'm not sure. I don't see acute Graves' disease very often for obvious reasons, but I do have one patient who was treated in South Africa by exactly that route, and her Graves' disease was cured by high-dose iodine. But that's just one case history I can quote. But on my website, if you put in Google and if you put iodine in the search in the top right-hand corner, you'll see my iodine pages, and there's a little bit of historical stuff about the sort of doses that iodine has been used for in the past, and how it's been used, say, to treat overactive thyroids and underactive thyroids.
Thank you. Quite a major question here, perhaps to finish with. Can you suggest what might help with neurological symptoms and neuroinflammation?
Well, inflammation of the brain is inflammation. And it's all these things that we've discussed, because they all impact on the brain. They get in there. Low dose naltrexone may be very helpful, but I think this is an area where microimmunotherapy is going to be a very useful tool. Now, I don't pretend to be skilled in it. There aren't many practitioners in this country. I'm on a very steep learning curve. There's a little bit of stuff about microimmunotherapy on my website, and there are, I think there's contact details there of practitioners, who use this, but it's difficult, it's complicated, but start off with the groundhog regimes. And what I do know is for so many people, those regimes done well get them an awful long way.
Thank you very, very much. I'm just looking through. There are so many more questions. I think we're going to have a...
I don't mind running on for a bit if the people are keen.
Well, some of them are about vaccination, which we had said we wouldn't cover yet because it is a bit early, really. We'd said that for our other speakers in the mini COVID series. But do you think that the huge attention now that's being given to COVID will change the therapies available for, and also the recognition available for ME patients in the future as a result of that?
Well, massively the recognition, because long COVID is ME, and everybody will know somebody who suffers from that. So, that is very helpful for current ME sufferers. But, the starting point to treat these inflammatory conditions are very simple things like vitamin C, vitamin D, or the ketogenic diet. There are, over the past year, there have been some fantastic studies clearly demonstrating the efficacy of these interventions. Are they being adopted by mainstream doctors? No. And that is what is so shocking. With all these conditions, we should be following the science. Let's look at the studies. And these are studies done by consultants, frontline consultants, in this country and all over the world. And they're all coming up with similar results about the efficacy of vitamin D, the efficacy of vitamin C, iodine, ivermectins, and other treatments as well. So why isn't this become mainstream? And the shameful answer to that question is follow the money. Who educates the doctors? The drug companies. And we are being spoon-fed a very simple paradigm, that we've got this virus and the only way to get it up is have the vaccination and then you can get on with your lives. And people are being blackmailed into having the vaccine for all the wrong reasons. And with these nutritional interventions in place, the vaccine becomes completely irrelevant, because not only will these nutritional interventions protect us from COVID, but also influenza, influenza A, influenza B, Lyme disease, Epstein-Barr virus infections, herpes infections, and so on. That is supporting the immune system and let the immune system get on and do its job as it has been for the last 2.5 million years, which is why we're here today.
Thank you. Is fasting advised as a mechanism to dampen inflammation in long COVID?
It's a very useful intervention. Yes, I do use fasting, but I wouldn't fast anybody until they are keto adapted, because you just make them jolly hungry and jolly tired and you just put them into keto flu instantly. So yes, I do use fasting, and say first get PK adapted, and then intermittent fasting is very helpful. And we have a very good evolutionary basis for this. Did primitive man get 3 meals a day? No, he didn't. And what's so interesting about when you fast is that the brain gets sharper, but you switch on something called autophagy, self-eating. Now, I'm going to digress for a moment, so forgive me. We have very good storage mechanisms in the body for fuel, for sugar, and for fat. We can store it as fat in our bodies. We don't have a good storage system for proteins. We cannot store proteins in our system, but there is a requirement for protein every day. We do have a protein need. Now, I think one way the body gets around this is when cells become old and senescent and should really be, spring cleaned away, it hangs on to them longer than it should. The point here being that if we go through a period of fasting for whatever reason, the first thing the body does is it gobbles up those old senescent cells, because that's its protein source. So I think that has evolved in order to give us a protein source in times of need. But if you're satisfying your protein requirements every single day, day in, day out, you end up with an accumulation of all these old cells that actually we'd be better off without them. We'd be better, we're better out with these, senile immune cells, these, ancient muscle cells that are getting in the way, and so on. And autophagy has lots of very, profound and beneficial effects. For example, it may be that that's how we deal with cancer, because we're throwing up cancers all the time. I mean, the figures are, we produce about 10,000 new mutations every second, and that's just from background radiation and background metabolism. And the immune system goes around and it's looking at these things and nips them off. So let's hope none of them mature and become a problem. But the more we are nourished, the more of these cancer cells are going to be surviving and hanging around. But as soon as you stop eating, they are going to become the protein source. And so the immune system is going to go in and gobble up these spare cells that are swilling around. And just to give you an example of this, I've been dealing with a lovely lady over the past 2 years now, who presented with the multiple myeloma. And she had her first lot of chemotherapy, and it had knocked it back a bit, but the thing had come back. And the consultant saying, well, do we do another lot of chemotherapy? It's quite toxic. And she had very high cancer markers. And she came to me and said, what can I do? So I said, well, you've got to have the chemotherapy. There's no question about that. But you must go onto a ketogenic diet. Why? Cancer cells can only survive on sugar. They love sugar. So starve little bits of sugar. Take vitamin C to bowel tolerance, because then the cancer cells grab vitamin C because it looks like sugar biochemically. And as they absorb the vitamin C, that kills the cancer cells. Anyway, we did a regime whereby she was ketogenic all the time. She was vitamin C to bowel tolerance all the time. But on the day of her chemotherapy and the day after chemotherapy, she fasted. So she did at least a 2 and sometimes a 2.5 day fast during that time. What was so fascinating, she said she felt wonderful. She hardly had any side effects from her chemo. So she continued to function at a very high level. And at the end of that, a consultant said, well, let's recheck your cancer markers. Now, before, her cancer marker, which is called the Kappa marker, was over 1,000. He said, it'll be a miracle if it's below 100. And we reckon that a cure is when it's below 20. And her result came back at 23. So that combination of ketogenic diet, fasting, vitamin C to bowel tolerance, massively enhanced the efficacy of her chemotherapy. And, you know, of course, we've got very good biochemical and immunological explanations as to why that should be. But it's simple. Anybody can do it and put themselves in a much better, you know, place as a result.
Superb. Thank you so much. There are still so many questions coming in. I would suggest that particularly your book, The Infection Game, is probably the most appropriate of all for long COVID. Is it, would you say, or do you think that's taken by?
And I would hate to say, I mean, for chronic fatigue syndrome, and long COVID is a variation of that, that would be a good starting place, because that talks about the energy delivery mechanisms and, you know, some, you know, starting points to treat chronic infection. But I mean, my most recent is Ecological Medicine. That's probably the most up to date. But what has been popular are the workshops which I run, where anybody can join. You buy a ticket from my sales at Dr. Myhill, and I think it's £40 for a day, and we limit it to 20 people. I'm doing a day tomorrow as it happens, and I just talk away like this all day. I like talking, and people are very kind. They seem to like listening, and anybody can ask any question at any moment, and you usually go down well. At least I can set people on the path to recovery and hopefully infuse them to put in place the difficult regimes that I'm asking them to do, because they are difficult. You know, they're major lifestyle interventions.
Fantastic. Thank you. Well, you've given us lots and lots of ideas, and I think we know now where to go for further information. So thank you, everybody, for being here and for all your questions. And Sarah, thank you so much for all this tremendous.
My absolute pleasure. You always ask the right questions, Gillian, so you make it very easy for me, because I can then just rattle on.
From all our wonderful attendees. We will be having a mini series very soon on the mitochondria this time. So it will take a few weeks until we have that organized, but I'm sure that Sarah will be part of that as well. So some of this will be covered then again. So thank you very, very much, everyone. And Sarah, thank you.
My pleasure. Thank you, Gillian, for being a great hostess.
Bye-bye. Thank you.